Hello, Miss Phillips.
Oh, hello.
Hi.
Hello.
I'm Dr. Mudria. I'm one of the psychiatrists. I understand that your friend Mark has asked you to come and see me today.
That's right, my partner. Yeah, thank you for meeting with me. Thank you.
No, thank you for coming in. What would you like me to call you?
Oh, Kim.
Kim.
Yeah.
So, Kim, I understand that Mark's dad has been diagnosed with a memory problem.
Yeah, Alzheimer's, yeah.
Okay, so how much do you know so far?
Well, it's been a very recent thing that we've found out. Mark's dad has been behaving a bit strangely, very forgetful, gone wandering a bit. So he was, we first took him to the GP, and then he got sent up for some tests and saw, I think, well, Mark took charge of that, saw various people. And then we were told last week that it's Alzheimer's.
Okay,
Yeah.
so it sounds like it's a difficult time for you and for Mark.
Yeah, I obviously, I know his dad, but obviously for Mark it's much more upsetting, which is why he said it would be okay for me to come and ask questions on his behalf.
Okay, so I'm here to answer any questions and obviously explain to you more about what Alzheimer's is and the medication and treatment options.
Great.
Yeah, is that okay with you?
Please, yeah.
Okay, so as you mentioned Alzheimer's, you seem to have a lot of knowledge already.
Yeah.
But I'll explain to you, Alzheimer's is a type of dementia.
Okay.
So it's a type of memory problem.
Mm-hmm.
And it's dementia is the umbrella term for the different types of memory problems.
Okay.
And Alzheimer's is just one type of it.
Okay.
Yeah, are you following me so far?
Yeah, absolutely. Yeah.
Okay. So in dementia, it affects a person's, there's three main domains it affects.
Right.
So a person's cognition, their functioning and their behavior.
Okay.
Yeah. So cognition has to do with your memory.
Okay.
Okay.
Yeah.
And your thinking.
Yeah.
And then the behaviors is like any changes in behavior like aggression or agitation.
Okay.
And functioning is to do with the day-to-day activities.
Okay.
Yeah. Are you following me so far?
Yeah, that makes sense. Yeah.
So like you told me, with Mark's dad, his memory started to deteriorate and he became more and more forgetful.
Yeah.
So that's what happens in dementia. And then they also progress, slowly progresses in Alzheimer's, where they start to become more and more forgetful, start misplacing things. Later on, they start having difficulty in speech, in finding the right words.
Okay.
They also have difficulty in their functioning, with taking care of themselves.
Yeah.
And sometimes in the later stages, they'll have problems with their behavior in terms of being agitated or more aggressive.
Okay.
Are you following me so
Yeah,
far?
that definitely sounds like Mark's dad, yeah.
Okay. I know it must be so difficult for Mark and also for you as well to see what his dad is going through.
Yeah.
What I can say is that obviously in terms of the cause of Alzheimer's, no one knows you can't pinpoint one specific cause, but what we do know is that Alzheimer's is a genetic component, so it's hereditary.
Does that mean then that Mark is likely to get it?
There is a chance. So there is a chance that if someone has a family member who has dementia and Alzheimer's, that there's a chance that they could get it. It's usually if it's the person gets the memory problem before they're 65 years old.
Okay.
There is a chance that the family member can get dementia.
Okay, Mark's dad's 75, so yeah.
Yeah.
Okay.
And there's other causes as well, like older age, certain medications can cause problems, certain illnesses. So we can't pinpoint exactly one cause.
Okay.
Yeah. The way we've diagnosed this, as you must be aware, is like you told me, like he came into hospital, we've done a thorough history, we did a scan of the brain, and we took some collateral information from Mark and from various family members, and that's how we were able, and blood tests and psychological tests, we were able to identify that he has dementia. Okay.
Yeah.
So I understand you must be concerned about what happens next.
I guess really what Mark's really hoping that I could find out is if there is any kind of treatment. I've got the name of a treatment written down. I don't know if it's appropriate or not, but my mother's neighbour suffers from memory problems, and she was given this medication. Is it okay?
Yeah. donepezil.
Yeah,
Okay.
and I guess we were wondering if that might be an option for Mark's dad.
Okay, well, there are treatment options available. Well, donepezil I'll talk about, but just to say firstly that unfortunately there isn't a cure for dementia, for Alzheimer's dementia. We have treatment in the form of medication, psychological and social aspects. However, it will only help for the symptoms, but it will not cure the illness.
I see, okay.
Do you understand? So what I'm trying to say is that the memory problem is not going to get better. It will only help to slow the progression of the memory problem and the illness.
So if you took medication and it worked, it wouldn't help him to go back to how he was, and he'd still be as he is now?
Yes.
Okay, I
Yeah.
see, yeah.
I know that's probably not the news that you wanted, but what I can tell you is that the medication you mentioned, the donepezil, so we have a group of medication called the anti-dementia medication.
Okay.
So donepezil is one of them. We have others, rivastigmine and galantamine. And usually they started this medication after we've done some blood tests and memory tests.
Okay.
And usually it will be done in a clinic, in a memory clinic.
Okay.
So we usually start them on medication, and what we notice is that it helps slow the progression of the illness, as I've told you.
Okay.
Yeah. The medication has side effects like other medications.
Okay. What are they?
It can cause a slight tummy upset and nausea, but
Okay.
usually it just shows that it usually resolves once someone gets used to the medication.
Okay, it doesn't sound too bad.
Yeah. And we usually follow up the person for 3 months or 6 months to see how they get on with the medication.
Okay.
In terms of the other treatments, we have psychological support as well as social aspects. So helping him with maybe carers, meals on wheels later on if it gets difficult for your Mark's dad. And we can look at a dosage box if he starts to forget to take his medication.
Okay.
So there are other aspects of treatment which I can discuss with you at some point when with Mark.
Okay. Oh, if you wanted to start the medication, then are we able to get the ball rolling on that?
Well, we can look at Mark's dad and do some blood tests.
Yeah.
And an ECG and other tests.
Okay.
And his baseline mini mental state exam, and then start him on medication.
Okay.
As long as there's no contraindications to the medication.
Right.
Yeah. Thank you so much for talking to me. I understand things must be so difficult for you, Kim.
Yeah.
But I can assure you that I'll give you a leaflet more about the medication. You can have a read about it, and we'll make another appointment.
Okay, thanks so much. Thank you.
Yeah.